Wonderful. Thank you so much for having me. It's a pity I can't be with you in person. I would have loved to come, but I was on a multi-week travel marathon through different conferences, and my wife warned me that the kids are going to forget my names. And if there's one thing that's not good for longevity, it's if your wife is mad at you. So that's why I'm only here
That's a
virtually.
universal problem.
Can you hear
Yeah,
me?
no, nothing,
Yeah.
doctor. Yeah, you can go ahead.
Perfect. So yeah, what I really love about these conferences is that there's always an amazing amount of smart people in the room. And it's amazing to have these conversations. And there's the saying that when you're the smartest person in the room, you're in the wrong room. And definitely every time I feel that at these conferences, I'm definitely not the smartest person, but I often ask myself, why did you guys even let me in? So it's really amazing to have all these interactions with all of you guys. And it's very humbling at times. And there's so much great research going on. Or there's so much great research in many different areas, in biology, in medicine, in chemistry, in molecular research and all this. And if there's one observation I can make is that sometimes it feels a little bit that there's a lot of search going on for, in a way, the magic bullet, right? Or the magic pill maybe is the better word. So that one pill that will extend our lifespan, extend our health span, that we just pop the pill, and then we can live 20, 30, or 50 years longer. And don't get me wrong, I think that's very important research, and we should definitely continue to do that. But what we also must not forget is that, in a way, we have this magic pill today already. And that's something that's sometimes it feels like, with all the excitement about these great developments, we seem to forget that. And what is that magic pill? If we think about one of the most common diseases that's massively decreased not only our lifespan, but also the quality of our life, it's cancer. And cancer, I'm sure everyone is in some way or form affected by cancer. I'm sure everyone in this room, whether virtually or physically, has had someone who's suffering from cancer, lost someone to cancer, maybe has been suffering from cancer yourself. And there was a study in the Lancet journal, which I'm sure you're familiar with. It's one of the most prestigious scientific medical journals, a while ago. And that study looked at what percentage of cancers can be avoided just with lifestyle. So they called it modifiable risk behavior. So what percentage of cancers can be avoided, which is not genetically or not through toxins in the environment, but just through lifestyle. And whenever I ask this question at conferences, what people's guess is, it ranges from maybe 2%, 3%, 5%, maybe 10%. But the quite shocking answer is that it's 44%. And I want you to really let that sink in, because while we're looking for this magic pill, while we're looking for the great solutions out there to make us keep longer, we could cure every second cancer essentially just through lifestyle, and we're still not doing it. And I find it always quite fascinating, but also quite shocking. And the question then becomes is, why are we not doing it? Why do we have that? And what even defines our health? And so there's several things I want to discuss. So first of all, why are we not doing it? It's we're creatures of habit, right? No one likes to change their lifestyle. No one likes to change how we live. We've always been doing the things we've been doing. So that's definitely one factor. But then we also need to look at what defines our health. And if we really radically simplify it, our health, and that of course is then directly linked to longevity, is essentially in two areas. I mean, it's we have our genetics, and we cannot change them, at least not for now. And we all know there's some interesting research going on around CRISPR and so on, but there's no practical way to really change our genes. So whatever we were born with, we have to live with. And with regards to genetics, there's two categories, I would say. So there's the mutations, where if you have something that's a mutation and it severely impacts health, you cannot change that. And no, that's this category. There's things like the BRCA genes for breast cancer, where if you have that, then you're getting a high likelihood of developing that disease, and you cannot do anything about it. The good news is that if you're listening to this, then you're most likely to not have any of these really severe mutations, because otherwise you wouldn't be here, because most of these will then end your life earlier in your lifespan. But then there's the other 80%. The other 80% of our genes are genes that may negatively affect our health, also positively, potentially. But we can, up or down regulate them with our lifestyle. And so in that way, that's what I was saying is that's where our magic bullet really is. Because if we think about it, if we're honest to ourselves, what are the biggest impact factors on our health as we speak? It's essentially 4 categories. It's how we eat, it's how we take care of our body, how we exercise, it's how we sleep, and it's how we take care of our mental health. I think these are the 4 big levers. And if you get those right, then you have a very good chance that even if you have genetics which are not ideal or might have some risk factors, you can influence a lot. And also these 4 big categories will dramatically help you in your longevity and in avoiding not only diseases like cancer, but also a lot of the chronic diseases that many of people around the globe are really suffering from. So so why is not everyone doing it, and why do we not all live an optimized life? And there's 2 reasons for it. And one I just mentioned before, it's creatures of habits. It's really hard to change our behaviors. But also if we want to really optimize our health based on these various factors that we can influence, we need to understand a lot more about what's going on in our bodies. Because if we think about our health, there's several factors that we can impact, and what does the right diet mean? What does the right exercise mean? What does the right other factors mean? That's different for everyone in the room. And so while of course there's general recommendations about that we should all sleep enough, we should all eat a clean diet, and what precisely that is, and finding the optimal point in to really optimize your health and longevity, that's different for all of us, and that's why we need data for. And I started a small company called Biolytica, and essentially we are in the field of health data. So we are focused on providing a solution for healthcare professionals. So our clients are typically longevity centers, preventive medicine institutions, high-end wellness, personalized wellness centers, and so on. And we help these institutions to really gather data about people in very different areas, from genomics, pharmacogenomics, epigenetic tests, biomarker tests, nutritional information, lifestyle information. And then based on this data, our platform allows them to really create hyper-personalized and hyper-optimized health and longevity journeys for their patients or for their clients, however you want to call it. And because data is a very, very boring field, and I don't want to get you to sleep at the second day of the conference in the afternoon, I want to quickly show you how using data can really look like in a practical application to make it a bit more understandable, and really show you the amazing effects that just understanding the right data points about someone can really have a massive impact on longevity. So allow me to quickly share my screen. And I hope this is going to work for you. Let me just get here. That's always the downside of doing things online. All right. Okay. So let me start with asking the question. No, we are essentially not living in a healthcare system. We're living in a sick care system, right? Because usually what we do is we don't support health and staying healthy. We support fixing issues. And I want to show you. I want to start a little my presentation with a little video that was recorded last year in Italy that really shows what's wrong with our healthcare systems. And that really shows why the approach that we're doing is wrong. And this video was secretly recorded, and the people in the video didn't know that they were recorded. So please don't share this video with anyone outside of this group. But yeah, let's get started. So yeah, this is me and my middle daughter back in Italy in one of those playgrounds, playfair thingies, and playing the game of whack-a-mole. But when I saw the video, I actually realized that that's a great representation of how we do healthcare today. Because in our healthcare systems, what we do is we wait for issues to pop up, to symptoms to pop up, and then we hit them with the next best thing. Typically, that's medications, pharmacology, and then we wait for the next thing to pop up, and then we hit that, and then we get side effects, and then we hit that. And then it's kind of, in a way, it's an endless game of playing whack-a-mole. And we believe there's a better way to do that. And besides the platform that we've built, we also work with people directly and help them to optimize their health. And I want to show you a case study of a real person that actually came to us a while ago and that we worked with. And I really want to show you how we use data to optimize that person's health and longevity and lifespan. So of course, we changed the name, we changed the images, but the data that you see is real, and the data that you see is from our platform and from the interventions we did that with that person. So let's call that person Bob, and Bob is like many of you in the room, right? He's very successful, family man, middle-aged, entrepreneur, very high energy person, and so Bob also has something, or has developed something over the years, which is called metabolic syndrome. And metabolic syndrome is not an acute disease. It's more like a cluster of different symptoms. It's fatigue. It's inability to focus, blood pressure, blood lipids out of whack, being pre-diabetic. And what metabolic syndrome does, it puts you at much greater risk late in life to develop things like cancer, develop things like diabetes, neurodegenerative diseases, and so on. So it's not something that kills you immediately, but definitely has a big negative impact on your longevity and on the quality of your life. And why this is so important to talk about metabolic syndrome, for example, is that 1 in 3 people statistically, so 1 in 3 people of everyone listening, either already has metabolic syndrome or will develop it along your life. So it's a disease that affects a lot of people. And so what's the typical, let's say, standard sick care system response to someone with metabolic syndrome? It's medications. Yeah, we need to put you on statins, we need to put you on anti-diabetics and all these things. And that's exactly what happens with our person and with Bob. He was put on a variety of medications by his doctor, but then every time he went for checkup, things got worse. And the answer was, okay, we need to give you more medications, right? That's a typical answer that we get from the healthcare systems, sick care systems. And of course, now with giving more medications, you get more side effects and all the different wonderful things from issues with muscle wasting, liver issues, erectile dysfunctions for the gentleman in the room. So really, it's something that really negatively affects your life and impacts your healthy lifespan quite dramatically. So he said, look, I'm not even 50 years old. I don't want to be on medications for the rest of my life. Isn't there a better option? Isn't there an alternative way to approach this disease that I have, this condition that I have? And luckily, he knew someone from our clinical team. And then that person from our team talked to his doctors, and they said, look, we don't really believe in that, and we don't really believe in health optimization. We don't really believe it can do anything here, but we're going to give you 2 months to try out whatever you want to try out, and if that doesn't work, then it's back to more medications. So okay, challenge accepted. So how can we look at healthcare differently, and how can we use data to really impact healthcare? And there's different things. So first of all, typically, this is how your doctor sees you. Like, you're essentially a bunch of lab values, and unless you're really in depth into the field and in medicine, it's really hard to be involved because most people don't understand what all these values mean, and that also makes it very hard to be involved in your personal health journey. So the first thing we can do, and the first thing we do, is we just take these values and visualize them differently, right? And make them more, let's say, understandable for people. And so what we could see in this specific case was that we were dealing with a person who had multiple issues at the same time. Blood lipids 3 times too high, chronic inflammation almost 10 times too high, blood pressure through the roof, very close to a cardiovascular event probably, issues with detox with his liver, almost twice as high, cholesterol was out of whack. So really we're talking about someone who was middle-aged, but was already chronically ill and was definitely steering towards serious health events in a matter of few years. And of course, that's not good for longevity. Then we need to look at, okay, the picture that we're getting from this data, is that just a singular instance, or is that something that's has developed over time? And what we could see, looking at all lab reports, analyzing them, is yes, that was something that was an ongoing problem. So there was not just a little hiccup because there was some underlying acute condition, but this was really something that it was clear that Bob was a chronically ill person. What else can we look at? I mean, typically what your doctor would look at is what kind of medications are you taking at the moment? What kind of medications have you been taking in the past? And then that's pretty much about it. So usually, as I told you, the typical answer from our sick care systems is giving you more medications and just doing more whack-a-mole with symptoms. But there's more that we can do, and there's more data that we can use to optimize your longevity. And one of the most important things is genetics, because everyone in this room, everyone who's listening, has a different genetic markup, has different genes, has different constellation of factors that will positively or negatively impact your health that we can optimize around. And so typically a raw genetic report looks something like that, and unless you're a geneticist, you really cannot do much with that information. But what we can do is we can use algorithms to take that information and group it, so to speak, alongst several different pathways. So we can look at what genes are affecting which areas. And what we could see for that person was that there were some genetic risk factors or high impact factors in the areas of inflammation, of detox, for example, of cholesterol, and a few others. That's very, very impactful. But what's other data that we can use? Other data that we can use is, of course, now everyone is wearing wearable these days. I'm sure a lot of you are wearing the Oura Ring or wearing a smartwatch, and we can use that data to look at the lifestyle of people. We can look at their activity, we can look at their exercise patterns, we can look at their weight from smart scales, we can look at all different kinds of things. So we did that, and what we saw was that that person, Bob, was living a very sedentary lifestyle. So not enough movement, couch potato or office potato, however you want to call it. And there was just not enough movement in his day-to-day life. What's other data that we can look at? Of course, there's nutrition. And nutrition is, as we all know, diet is one of the biggest impact factors on anyone's health. But how do we track nutrition? That's really complicated, because you can ask people to do food journaling, but then again, that really will not. No, people won't do that. If you ever done a food journal, you do this exactly for 2 days, then you stop doing it. But everyone is wearing a phone in your pocket, and at least my generation, a lot of people are taking pictures of the food anyway after every meal for Instagram and so on. So we can use these images and then run algorithms over them and really see, okay, what are the how does the nutrition look like? And what we could see in that case was that we saw way too much sugar in the diet, way too many simple carbs, and overall a very unbalanced diet. Now, so what do you do with all the data? So in our platform, we can do several things. We can calculate aging clocks, which I'm sure you're familiar with. Which gives us a hint about how much older or younger that person is biologically than versus chronologically. In that case, we could see that all the aging clocks showed that he was over his chronological age. But more importantly, what we can do is we can combine all the data sources together and get a fuller picture of someone's health, and showing us let's say the areas of, we always call it like the low-hanging fruits of your health, the areas where we can really start optimizing, because not only do we have a problem there, but also we can see that we can have the biggest impact with small lifestyle changes. And what we could see in the case of Bob was that there were some issues on the cellular level around inflammation or detox, around cardiovascular health, cholesterol, and some other areas. So we use this information, and that information can also give us, let's say, a lot of options on what we can do. And we can really start to truly personalized health journey for the person. But based on what we knew, there's a multitude of things that we thought might be beneficial for that person to optimize his health and longevity. But of course, we all know we're creatures of habits, as I told you before, and no one is going to change 50 things at the same time. So we really needed to know what are the things that we're going to have the biggest impact based on all the data that we gathered before. And using all the data and using our platform, we really focused on 3 main areas, in the areas of inflammation, of cholesterol, and detoxification. Relatively easy and simple lifestyle changes that he was able to implement in his day-to-day habits. So we also changed his diet quite dramatically. Massively reducing carbs, going on a high-fat diet, very strictly, very dramatically. We made sure that he's training in the right way, which was right for his genetic type. So really moving him from a more strength-based training, in this case, to a more endurance-based training, optimizing that. And then what impact did we have with that? Remember, the traditional doctors gave us 8 weeks to optimize. And the changes that we got with these personalized, hyper-personalized lifestyle optimizations were dramatic. So essentially, within just a few weeks, inflammation CRP reduced back to normal. We had triglycerides, blood lipids 3 times too high, stabilized after 5 to 6 weeks. Then we had, fasting glucose. So he was pre-diabetic. That almost immediately stabilized once he was on a low-fat diet, high-fat diet, sorry. Liver values normalized within just a few weeks. So really, we were seeing dramatic changes in his health in a very short amount of time, just with the right data-driven, personalized longevity optimizations. And now the interesting thing is, moving forward in time, he still is keeping all his healthy values. He kept his lifestyle changes. He went from being a chronically ill person with massively reduced longevity to someone who's now basically off most of the medications he was taking before, enjoying life, lost a lot of weight, and really is someone where we could see that this personalized data-driven interventions is really something that was a great success and great help. So that's just one example on what data can do. And I just want to take the last few minutes to just address to one thing that I'm seeing over and over again, also at these conferences when I talk to people in the longevity field. It's amazing that we are a community that is really open to experimentation and self-experimentation. And you meet a lot of people that optimize their longevity. They take a lot of supplements. They take a lot of everything. But what I can see, and what we also can see in our day-to-day business, because we also have a clinical team, we work with people directly. We often see people that actually are overdoing it quite a bit. So they are taking massive amounts of supplements, for example. And we had some cases where some of our doctors were seeing people coming in close to renal failure. So the kidneys almost close to giving up because they were taking 70, 80 supplements at the same time. Every time they read something in a book, they just started taking these supplements. And I just want to caution everyone that it's great to do self-experiment, but make sure that whatever you do, use data to your advantage. Don't just blindly take stuff just because someone mentioned it's good, because it might not be good specifically. And so what we always do is we tell people to first start from scratch, wash out everything, don't take anything for like 4 to 6 weeks. Then take a baseline, so measure your biomarkers. Get some data on yourself, see what your current diet, your current lifestyle will provide you with. And then if you see a need, then you can start adding supplements or adding certain molecules. And another word of warning as well, and I had a very interesting conversation with Brian Kennedy a few weeks back in Singapore. Also be careful with the molecules that you hear about that might have a positive impact on things like the mTOR pathway, for example, because maybe taking one of these molecules may be beneficial, but if you take 2 or 3 at the same time that all target the same pathway, you might always go in the wrong direction, right? You might always downregulate something too much, whatever pathway it is. So what I'm trying to tell you is use data to your advantage, and really use data to measure yourself, retest yourself, and be very careful with interventions and be very data-driven with your interventions, because that will really tell you where you are in your health journey, and you should never do anything blindly. And I highly discourage anyone from taking dozens of supplements at the same time without really knowing how they work, how they impact themselves, and without really understanding the data that we have. Some final thoughts on data. I personally believe that data is incredibly beneficial, but for anyone who's maybe working with data, and there might be some people in the room that work with health data, that try to optimize longevity based on data, that maybe develop similar products and also similar apps in different fields. I think we need to be very conscious about how we use data, because with data we have 2 big areas of that are problematic, put it this way. One is the area of trust. A lot of people don't trust data. They believe that data can be abused. And that's a fair statement to make. That's a fair point, because data can be abused, yes, and we all know that data is being sold. There's lots of data points that I would not my insurance company to know about me, right? Because I might have some genetic issues or might have some other issues, and I wouldn't necessarily want my data to be floating around freely. So I think everyone who's dealing in the data field needs to be very conscious about that, and needs to be also very responsible about data. Because if we abuse data, and if we take advantage of data that's detrimental to others, and if we sell data, for example, we're just going to ruin the trust in data. We're just going to ruin the trust and the positive effects that I just showed you that data can have. And this way, we're going to really negatively impact the whole industry. The second issue is around compliance. Of course, with trust comes all the issues around compliance. Data is a very boring, but also very complicated subject. We need to be very careful to follow all regulations if we're working in the fields, which are different, which are very complex around the globe. But I believe that these data regulations are not our enemy, they are our friends, because they help to gain trust. They help to make sure that data is not being abused. So while, of course, it's a pain in the butt, to deal with all these compliance issues and regulations, I believe it's a very useful thing, and it really helps to have a wider audience keep their trust in the positive effects of data, and really allows to create solutions and create services and create software and platform and so on, to really help us optimize our health and help us optimize our longevity. As a final word, is data always the right and only answer? Yes and no. So as you can imagine, I'm a big fan of data, because I'm seeing the positive effect it has on people's lives day to day. I'm seeing how much it can change people's lives. I'm seeing how much it can impact health and longevity when used correctly. I can really see how data is part of that magic bullet that we're looking for, how it can help us extend healthy lifespan by 10, 15, or even more years, just using it correctly. But it's not always the right answer. And we've seen cases. We had one case of someone coming into our clinic, or to our clinical team, who was obsessed with data. So he was tracking everything, had 3 different sleep trackers at the same time, a smart mattress, and then, whatever, the Oura Ring, and then another sleep tracking device. But he had sleeping issues. He couldn't sleep through the night. And he was obsessed with that. So every time he would wake up, he would immediately look at his stats and look at his different devices, and then, damn it, I should have gotten 23 more minutes of deep sleep and whatnot. And then he couldn't fall asleep over it, because he was so obsessed. So what we said was, in that case, look, you know what? Get rid of all the stuff. Get all of that stuff out of your bedroom. Forget about collecting data about yourself. Forget about your alarm clock. Just try to sleep. Just go to bed and wake up whenever you feel like it. Try to get back to your natural rhythm. And the interesting thing was, after a few months, his sleeping pattern has dramatically improved. He really has now good quality sleep, a right amount of sleep. And the solution in that case was to actually not use data, but to go back to instinct and the natural intelligence that nature has given us. That's it for me for today. I believe that really data plays an important role in longevity. I believe that we can really use it to our beneficial effect. And if anyone is interested, then please feel free to contact me. Happy to answer all the questions that you might have, and I'm happy to jump on a call anytime. And let's work together to improve health and longevity.